Thank you for joining us. We welcome you on this webinar because it is of mutual benefit to all of us who are working in Africa and its health. As you know, currently the WHO African Regional Committee is taking place, and I've just addressed it a few minutes ago. And the issue on non-state actors is coming up later tomorrow to be discussed. One of the issues post-pandemic has been that patient organizations in Africa need to be more engaged and more involved in Pan-African health policy. For this website, I need to go through some, for this webinar, I need to go through some simple health rules, as I say. Please keep your mics mute, but you can switch on your cameras if you like, that's no problem. And also from a point of view of if you have question and answers, please do put them into the Q&A box. The more the important, and we will address those. And as we go along, we will try to engage you into discussing things and bring you as and when we feel it's appropriate. Now, the issue that we want to address is very important. How can we all work together and be part of this WHO Regional Committee meetings every year? How can our voice be heard by our health ministers? Because they're sitting there, yeah? And the policy elite is there. I mean, you can absolutely see them. And how can we be at a stone's throw? Literally, I mean, you meet your health minister in the corridor and you can say that quick word to them. If you have that privileged status as accredited member, you can actually take them aside a little while and then talk to them. Plus, you can host side events and bring your issues direct to the ears of the minister concerned. So it's a very important forum. And plus, for younger policymakers, it's an opportunity for them to learn what's going on in Africa, improve their knowledge, skills, and attitudes, and get a good mind map of how things move, how is health policy achieved, and more importantly, how we are linked into the rest of the world. You can see the inequity of it, or the positiveness, depending on what you're doing, how you see it, and you can then come about and join the global family and make changes. I will start who we are. We are the International Alliance of Patients Organizations. We are about 300 members, over 72 countries, 52 disease areas. Our alliance is much bigger, and we've got over 2,000 to 3,000 members of members there and affiliates. Plus, we are very much interested in Africa for two reasons. We have the African Medicines Agency Treaty Alliance and the Personalized Cancer Care Alliance of Africa working on particular issues in Africa. We have over 30 African alliances and members directly working with us. We need to increase this to a greater number and bring them in. IAPO's three pillars of strategy for 2022-24 have been that we need to empower patient communities globally to advocate on patient-centered universal health coverage, drive the research and shape law and policy. And this is why we are here today, to shape law and policy. We want an African health system of future which are predictive, preventative, participatory, personalized, and preemptive. Predictive means don't let the disease happen. We've got tools there, genomic testing, other diagnostic testing, which can find early onset of disease and be able to deal. Plus, we can predict which patients will get certain diseases, for instance, in BRCA1, BRCA2 genes for women and breast cancer. We have to work preventative, meaning that once we know what's going on, let's prevent it. And once somebody has been diagnosed with a disease, let's use secondary prevention to stop it becoming serious. Participatory, it goes without saying that we have to be participating in it, that you have to be involved in it. And this is why we need to work with WHO Africa, shape this new Africa that we look at. My growing up in Kenya, and I know how isolating it was. health policy was little known to anybody. We don't know how things worked. And we continue in that frame of mind that our health systems are quite inaccessible to us as far as decision making is concerned. We want WHO to help us. And lastly, I think preemptive. I think personalizing is to make sure we deliver healthcare that we need to the quality we need and to our need. And then the preemptive bit is really important because we need to take action before anything happens. And you know the lessons from COVID-19. We weren't preemptive enough. I need to quote something from Frank Kafka that he said something very beautiful in one of his books called The Problem with Laws. And he says our laws are unfortunately not widely known, and they are closely guarded secret of a small group of nobles who govern us, and correct to that. Although we like to believe as compliant citizens that these all laws are scrupulous, and all laws, particularly because some of these are colonial laws, are scrupulously adhered to, we remain vexed because we don't know, we do not know what these laws are. And if you translate this into healthcare laws and health laws, it becomes even more of a mess. For us here in Africa, our healthcare institutional legal policy practice and standards framework is not widely known, even to some ministers themselves. You can be amazed when we were negotiating or talking about the African Medicines Agency issues. We were getting this response from some ministers, what is this treaty? And we said, you signed that, basically your government ratified that treaty, so you should know what's going on. But what we need to know is, more importantly, how can we shape this framework? Knowing what this framework is, and with WHO, we can all work together and shape this, I think, address those needs, access, and inequity that we're currently facing. Dignity, I think, restore our dignity as patients. We don't have to be sitting there with begging bowls and waiting to be invited into meetings. We can be there sitting with the minister equally at the same table and address them. Now, something from Europe. Well, I need to share this with you from Europe simply because in Europe, the patient involvement in many things is improved. Research and development, in the assessment, and you can see the roles that they've carved out. And these are roles that we can sit with WHO as well, simply because of that. Firstly, setting research priorities. Nobody is researching about rare diseases or neglected diseases in Africa. We always have diseases that matter to the rich nations or rich groups, and more louder voices being researched. Then when you get to looking at design protocols, you got protocols that don't meet our needs, then you look at trial of steering committees, very few Africans in there, you've got research on dengue fever, but very few Africans sitting on that, but most of them are Northern European investigators. Data safety monitoring, regulatory affairs, and all this has to be our role, and the WHO can facilitate this. Once you're part of that whole process, we can start getting skilled in this, and you start taking more place into it. You can get into setting research priorities, very important. Then you can design that research. You can conduct the research, be part of that, get paid for it as organizations if you're accessing groups, and then disseminating and communicating these results. We don't want to spread the infodemic that we were in. So these are all roles that patient organizations are developing within WHO. Europe, they're sitting together with them, and they're working with your party, Europe, EU, Europe, and others. So I am not pushing my way into the door, as they say, I am not barging in. I am not gate crashing this WHO's regional committee meetings. I have a right. We have a right. We have a authorization within it. We have a source of law, and the WHO Constitution is a piece of international law because it was ratified and adopted by, so it's one of the first health laws that were universal health laws that were established. And who says that health is a complete state of mental health, physical and mental health and social well-being, and it's not merely absence of disease. And then the highest enjoyment standard is our right. It's a fundamental right. We have to enjoy this. So we're not asking anything more than what our right is. We are not begging. We are just saying that's the stated right. But more importantly, then WHO's constitution says that health is fundamental to everybody's need, and it's especially peace, security, and economic development. Now we saw what happened with the pandemic, and it's dependent on the fullest cooperation of individuals and states. That's what we are getting authority from. That is what gives us, that's what we carry forward. When you go into a ministry and they say, why are you here? We say, well, we have a right from the WHO's constitution. You gave us that right because you adopted them. Then in the United Nations also gave us further rights. Again here, all the member states have adopted this declaration of NCDs, and a high-level political meeting that took place in New York in 2017, they adopted this declaration. And within that operating paragraph 54, it says we should engage all relevant stakeholders, including civil society, private sector, academia, as appropriate, to establishment of participatory, transparent, multi-stakeholder platforms and partnerships. Establish those platforms and partnerships to participate. And this is why we are here this afternoon, to see how we can progress this, how can we work, how can we establish partnerships with WHO, how we can establish those partnerships and then take it forward together and be part of the decision making. Then there is a framework engagement for non-state actors, which was passed in 2016. And the WHO adopted this framework to strengthen and streamline WHO's engagement with non-state actors. To define that non-state actor, it's a non-governmental organization. It can be private sector entities. It can be philanthropic foundations, academic institutions, patients organizations, alliances, and so forth. Yeah? And non-state actors are uniquely positioned to represent the target population. I think this is, what is for them and what is for us. WHO hasn't made FANSA out of courtesy or out of charity. They made FANSA because they need something from us. They need something, and that something makes us powerful. As I say, if you've got something to sell, then and that's something that we need to sell is our closeness of working with the patient groups. Many of you, I'm so glad you are here, work so closely, are patients yourselves. You work with patients themselves and you really do a sterling job in informing them, keeping them updated, making sure they have access to everything. But more importantly, I think what you have got is your networks, especially your social media, your influencers. Some of you are brilliant influencers. During COVID, I saw some excellent African influencers who basically are world beaters. I think my hats off to them. The level of communication and maturity of the communication and the creativity of the communication they had reached many people and got the desired result. Not only it grabbed attention, but it also informed and maintained that interest in that, and then the appropriate action from them. It was not just, oh, it's a funny meme and that's it. The memes made you think, they made you act, and they made you change things. So we are defined as that private entities, and we are very instrumental in defining how WHO works itself. Yes, the WHO does work with the non-state, with the state actors, governments, but at the same time, the governments and the non-state actors can have different perspectives. It's like looking at an elephant, as I say, from all angles, that you don't just see one side of it or one part of it. We can see everything. And during the COVID pandemic, we realized how important it was to be that be that watchdog and working. Then you have two routes in WHO. There's one which is official relations. So IAPO is in official relations with WHO. Official relations is a privilege guaranteed by the executive board, and they guarantee this to non-governmental organizations, international foundations, philanthropic, that have had and continue to have sustained systematic engagement in the interest of the organization. Meaning we should be interested in what WHO is doing. We have to maintain their mission and objectives. We work to help them access. As you know, we hold many activities, participating regional committee, our global patient safety action plan that we're calling on you to help us on this. World Patient Safety Day that's coming on the 17th September. We are helping you to work with us, and that's a bonus point. Yeah, that will give you accreditation automatically. I think for the next WHO, you all participate and we help you. We can give you very good credibility to apply for that status. And plus they have international membership. And the privileges that we enjoy are that we are invited to participate sessions which the WHO governing bodies hold. And this means that when we are participated in these sessions, we learn how to act with various state actors. We try to work with various performance actors. We form networks. We help them define prior, try to get our 2 bits in there, make sure that our interests are safeguarded, make sure that we have got that patient-centric view, and make sure that we have personalizing view. And there are 260 non-state and official relationship with WHO at the moment. Now, the second route we are talking today, and which is most important route that has been developed, it's the people who have no official relations. And this is the route we are taking from. Now, for non-governmental businesses that do not qualify to enter into official relationship because they are regional, like some of you guys are, small in membership, and they're limited to Africa, under FENSA, the engagement framework, regional committees, the WHO's Africa Regional Committee has decided on granting accreditation to the sessions. What this accreditation actually means and what benefits that bring is, like today, you could have been joining that WHO event and be part of it, either physically or virtually, and you would have the opportunity to say something on each of the health matters that were discussed. And you can participate with the policy elite, and you can determine the pathway that Pan-African health takes over the next decade. But more importantly, what pathway health takes in your own country, in your own neighborhood, for your disease-specific issue. You can dictate that to a larger degree once you're part of that body. You have eyes and ears there at the regional committee that can make things happen for you. This new route, as you know, is not an official relationship. It's to accredit non-governmental organizations, so forth, and we're working at the regional, sub-regional level. This will be accredited to participate in the Regional Committee for Africa upon invitation in sessions, and to submit, I think this is the big one, to submit written or oral statements. That's your way to put it through, yeah. You can actually put a statement there which shows what your worry is and what policy, alternative policy you want to do. You can raise awareness, and this will be listened to your minister, by your minister, and the team will be there. And there is nothing so surprising to them if they come up later on, when they're having coffee or water at the fountain. They're asked, Mr. Question saying there's some problem on this. And if the minister is not are ready to answer that, it becomes quite challenging. They will then, from their onwards, make sure that they invite you into national events. This is also your route. I call it the alternative route to get invited in the national debate, yeah, where you may be locked out. This is for if you want to get involved in all party groups in your parliament and put your issue forward. Now, what is accreditation procedure? The WHO has given a full document. We will send those links to you. Rachel will do that to you as well. But let me walk you through those. The eligibility criteria are this. Firstly, your aims and purposes or aims and objectives must be consistent with the WHO constitution. Must be aiming to improve healthcare for all, not only the physical, mental health care and well-being, and that you are committed firmly to the policies of the WHO, and this policy framework will share with you. This is about being equitable, non-discriminatory, non-political, commercial in what you're approaching, to use everything in fair value. Be open, share your values, just don't take, also share. And there's certain other values that we will share with those as we go. Part B, this is the ones I've marked in red is where we come in to help you. You should be actively engaged in the WHO region. Now, in the past, I've always said this, and I will continue to develop this, and I'm inviting you again. One way to address this is that IAPO will invite you to all of the events. By your being there participating qualifies you in having participated in a WHO event. We will put all the material on our website. We may even create individual pages for you guys. Make sure that even a microsite, I'm thinking of that a microsite where we would put all your engagement. And when they ask you, can you show evidence of your engagement? You can immediately go to that microsite and provide the link. You can say, yes, I worked on this webinar with the WHO's cancer control people. I work with WHO Africa's Global Action Plan team. We worked on a webinar on this. We worked on a webinar on that. We provided comments on the consultancy on this. We have posted WHO news on our website. And all that communication, Rachel and I will be there to help you out. We can work with that and give you, strengthen your case of having been actively involved with WHO. Directly, indirectly, or even in secondary form one, and all that counts. All that counts. It will count towards your marking score. More pictures, more activities, more comments into that. It doesn't matter if you're operating regionally or subnational. As I say, that's natural. If you're only national organization, we can pair you up. Maybe make you regional. Maybe like East African Community Network of some sort, SADC Community South African Network, or even West African Network. We can do that. But most importantly, I think it's got to be a non-profit in nature, and it's advocacy in that. We should not be commercial organizations as such. Now, we must have an established organization and a structure, consecutive, and a constitutive act and accountability mechanism. I was trained as a lawyer and I worked with, but we are here to help you. We work with the international advocates for international development. Rachel can put that A4ID. I've approached the A4ID, which is a consortium of about 3,000 lawyers who can help us in formulate or shape your, give you a model constitution, which is confirms with WHO. So in other words, we could get you that constitution, that document, that policy framework that satisfies the WHO's requirements, and then put that across to you, and you can then add it to your own policy documents or your own amendments to your own constitutions and that. And the accountability frameworks are obviously policy frameworks that you can design one-page frameworks. What does the process need from point of view of accreditation? Firstly, we need a name. It's very important to have a name that's not offensive. And I mean by you have to be very somber and sovereign, you know. Names like death to COVID, that sort of thing raise questions. Please do them. You should have clear objectives. I think very important. Look at what the WHO is doing and promoting healthcare, so that your objectives should be those. There can be broad objectives. To improve healthcare for all is a simple objective. To improve health, social welfare. Again, we can give you a framework of objectives you can borrow from and use. Many of you have got excellent objectives already established. Now, with the legal status, this is where our brains from A for ID and I can work with you guys. One is, we have been long thinking of city status, yeah? In many federal federal countries, Nigeria, etc., elsewhere, what we have got, the city council, like the Geneva, for instance, Geneva city, yeah, they do with the status. Yeah? They can give you a city status, which means you register yourself as a city voluntary group, non-status, non-state actor within that, or you can be a federal status as well. Sometimes, for instance, in examples, if you have federal state like Nigeria, again, you can be registered in one of the states with a state governor and so forth, the governor's body, or you can be a partnership under the partnership of the act of the law in that country, or companies limited by guarantee. That's another option that's given in that status. And the legal status is in your framework of incorporation, and we can work with those and govern. Then comes the governance structure. Here again, it's very important to have a constitution that defines who the chair is, who the secretary is, who the treasurer is, who are the board members, and what are the roles and responsibility, how decision is made, how decisions are shared, how they are done. And this should be a transparent, open document. We have got this in our memorandum of incorporation and other documents and articles of association. You can put those into it. Then the governance structures can also be structured around committees that you may form and how decision is made. And the main aim is to make sure that decisions are well considered, they're evidence-based, plenty of opportunity to debate, there is no bias, the governance is not discriminatory, everybody has a say in it, and everybody participates in the decision. And the main composition of this decision-making bodies is very important, making sure people with ethnic minorities, if you're included within that, any of disability groups are included in that, and go that extra mile and help all of them to work. Then your assets, as I said, you don't need much in Africa. This is why WHO Africa understands this, and this is why the Director General Moitib and others were talking about this, that for us, and this is said without prejudice and without derogation, that 2 chickens and a goat accounts for that, because if a village group has got that level of assets that are helping them in running that group is good enough. We are not looking for $1 billion bank accounts and that. All we need to know is that group is sufficiently resourced for that particular setting. we can't expect a village patient group to have thousands of pounds. Likewise, we can't expect national organizations to have billions of pounds. You know, so somebody raises the question, where is this money coming from? So all within their needs, and very important, and we will help you on that as well. Say, waiting support in kind. For instance, when IAPO will give you support or will help you in this, you can account that, you can price it up. And I always provide this sort of paperwork, you know, to show how many hours we spent, and we price it up for you, and you can say, this is in kind, you know. And this is how Africa works. It's both in cash and kind, and it's been going on for years, and sometimes even bartering. Yeah, you do my website design, and we will do your event, that sort of thing. Again, your annual income and funding resources need to be clearly shown. Here's a caveat: we don't expect or don't accept and expect that you guys have money from tobacco industry. We don't get money from the arms industry, and any other political donation that is linked to political decision making, or any other money that's coming in, for instance, a gun lobby or other kind of ways which are discriminatory and kind of not the done thing for you. And then the one that you really we can work with you and really kind of help you out is this affiliations. By either joining IAPO directly as a member or through our alliances and networks we have mentioned, that like a Marta and that. And if you do set up this microsite, which I have a strong mind to do now, is you can show your particular website pages if you have those. But if not, you can use our web page where you are mentioned with your logo and events and that, and our social media. We can track all those down and package them into one big package that you can then take it with them. And then the summary of engagement with WHO from now to next October. I'll tell you why October is important for next October. We can work together on a number of WHO events. Firstly is the Global Patient Safety Action Plan, where patient and family engagement is very important, and we can support you, you can support us. There's a World Patient Day, World Patient Safety Day coming up in 17 September. We can work in that. We can work in other consultations. As you said, we are also having our African Patients Congress next year. Again, we can work in that. And so forth, you can work with us on those, and then that will accredit you or show that you have engaged with WHO. We can satisfy that requirement for you in that way. Then some of the criteria, as we already mentioned above, yes, we will help you in strategy, values, and policy frameworks and others. We may have stock present. You can adapt it yourself. So your purposes are aligned. As you said, we work closely with WHO Africa and their events. Even the WHO Africa's national offices, we can connect you with them, and you can take part with those. And clearly, as I said, with FRID, we can start looking at helping you form a model constitution that you can then go and access pro bono lawyers in your own region and ask them to top and tail it, make sure that it's consistent with your national laws. We can give you those essential clauses and articles that you need to be compliant with WHO. And those articles are not too different or are not in conflict or do not offend your national legal documents requirements. As I said, before we open up for discussions over timing, and I think this is very important to us. It's very important for us on this, to run with this through and look at that deadlines, etc., that we have, And we know that each year, the 15th October is the deadline by which the non-state actors can put their applications in to be considered. So we can work with you to that deadline and make sure our commitment is made here. Thank you. Now, how can we help WHO? As I said, if they're helping us, how can we help them? We have said one of the things is that we look at how we can address the main component, which is looking at sorry, I've got to. So yes, so you can help WHO achieve the World Patient Safety Day market for that. We're Orange work with that. We can share with you what activities you can plan and undertake. There's a Global Patient Activity Plan 2021-22 that we need to address and work with. African Medicines Agencies is another project we are working with. It's very important that you work with us. As you know, Rwanda is hosting that agency now, but WHO is very interested in helping everybody be part of that, and WHO will be working with that agency in London. Then we've got the Personalized Cancer Care Alliance in Africa. We're trying to establish that. And lastly, I think we ourselves are looking at a Pan-African Patients Alliance new initiative to maybe shape everything in WHO region in Africa and work through this. Before I end this and open up for discussion, I just would like to say that the opportunity is here for us. It's very important that we take part in this activity and that it's fundamental to us to engage with this. And it's a time for us to reshape healthcare in Africa. And it's very important from that aspect. And now I'll take any questions and then we can start it. I will firstly address Ofra, I think, has raised the question about financial problems in low-income countries. As again, we said, I'll answer that question. Dr. Murthy has said 2 chickens and a goat are sufficient to show that you guys have got sufficient resources, that we've got in kind and in help across. So your income status should not buy you into that. All they want to show is that you don't have income from gun lobby or from tobacco industry. Then I think from Baija, from Morocco, I think, thank you, Baija. Please take example of Baija, from Morocco. Look at how she's done it. I think we all were saying that follow her example. Baija is a patient farmer, and then really leading life. She started with absolutely nothing, and Baija will agree with me on that, with nothing to work on. And she slowly, consistently, through her insight and tenacity and her great passion, won over many critics. She very sweet talking, very intelligent working through, and very fair and tough. Where there were obstacles, Baija really worked hard. She really moved work with that and take with us. Now, somebody said if they're a regional affiliate of an international NGO, yes, most definitely do ask your international NGO. In fact, we are encouraging our members to do that. As I said, please do ask your regional NGO. You can register yourself because this is about Africa. If you're an African entity, please register as a local. It brings you nearer. In fact, you can have what is called top and tail, meaning you can work at the global and you can work at regional. And you can plan global, act regional, and then perform nationally perfectly again. again, on the side of palliative care, Yaba, I think I have, as a former colorectal cancer patient, I think it's important to me to have palliative care in there. See the example of Dr. Merriman in Uganda. She is an example of the best palliative care approach we have seen, where she actually went herself to get opiates, bring them into the country, titrate and distill them to patient-centric doses and dilutions so that patients can get the right level of that dose to undergo that pain management. For surgery, the strength for palliative various stages from mild to extreme is included. And yes, we can work with you, Sarah, whenever you're link. Also, I agree with you. In Somalia, war-torn areas, again, we will help you on that. I think transitional countries and that I will most definitely, singularly, I'm trying to help people in these countries get, because that's where the need is the highest. You know, I don't want to be preaching up to the converted, as I say, to the high-income African countries. We need to get these countries which are got nothing there. And yes, we will find a way to help you out. And as I said, your document can be partnership or agreement only, some sort of regional. We can also look at ways you can set up maybe even a simple PayPal account to show what monies are there, simple amount of monies. You can raise funds. Fundraising will be a very big activity we can undertake with you. Look at that and make sure that you're able to cover your activity and expenses. Last one more question was somebody said, what is the paperwork required? The paperwork that's required is in that document Rachel will share with you. It's got the template and everything. Please have a look at that. We could hold an alternative webinar later on in September, maybe. Look at that and how we do. Okay. That's it for me. I think we can open the discussion. Thank you. Rachel?
Yes, we do have a participant that had raised their hand.
Okay.
Let me just unmute them. Bisman, the floor is yours. As we wait for him, I can see Sarah would like to talk as well.
Okay, thank you. So
Sarah, go ahead.
Yeah, thank you so much, Rachel. And thank you, Seth, for the presentation. I am listening to you and I'm getting a lot of diverse ideas, because here in my country, the biggest challenge as a patient caregiver is not only the issue of sickness, it's also the issue of the health caregiver being able to communicate to the patient at frontline. So for example, with somebody with 12 years of experience at the emergency department, I would want that, in as much as there are not enough beds in my emergency, my nurses at the frontline are equipped with knowledge and skills to train caregivers, even in the comfort of the patient's home. So again, for example, as a palliative initiator, I want that my end-of-life patient can stay home and still get all the care, nursing care at home. And so for somebody who is very interested in joining this organization, am I at the right place, or am I having conflicts of ideas? Because really, 6 years ago, I started a feasibility study on why healthcare givers are not doing this, and why we are always crying that there were no beds at the nation's emergency departments. And so, well, I really want to stay on this organization, so because I really want my voice to be heard. And once I am here, I think this is a very huge amplified area for me to send the message across. How do I leverage on the International Alliance of Patients Organization wanting to go to the frontliners in as much as we give quality care to our end-of-life patients and still be part of this organization? Thank you.
Thank you very much, Sarah. Firstly, Sarah, one way we can support you, I think, is becoming a member of the International Alliance of Caregiver Organizations. I'll put that link for you. I think that's been there for IAPO. We work with them. We were instrumental in their setting up, and they've got support packages there, and know your needs very well. There are carers like yourselves within that, and they can help you in working with those. Yeah, so that's one. Then the second is the Embrace the Carer. This is an initiative set up by MD Serrano, which was based in Germany, and Embracing the Carers, that again. So yes, we do need to bring carers into this WHO. WHO is welcoming those because they are what are called proxy patients, in that they are representing the patient's voice, especially if the patient is very young or infirm, especially with palliative care. The patient has got no energy to advocate for themselves, or they've got secondary person to voice them. So carers are the voice of the patient, as I said. You're most welcome. We can look at how we can be part of this and bring us up. We do need to bring carers into Africa with WHO as well. I think you're absolutely right. We agree. Thank you. Rachel, next one.
Bisman, the floor is yours. It looks as though Bismana is no longer available, Kawaldip.
Okay.
So maybe I think we can go ahead and mention that we're going to be holding the second part of the webinar.
Okay, thank you much. Okay, as you said, there's a saying in Africa that learning from paper is not enough. You must learn from experience. The WHO Regional Committee is sitting this afternoon or next, depending when the agenda is slow. But within this week, they will make a decision on who are the first batch of patient organizations who will be accredited. Yeah, that list will be published, and we will share with you. And our next webinar is to hold with those, select a few members from there and ask these organizations to share with you what their experience was, how they went about getting this accreditation, and then we can work with them on some of the paperwork that you might require, yes? So in other words, we are planting the idea, but then we need to know what the route was. What was this accreditation pathway? We'll also talk to those who failed to get that accreditation, yeah? It's not only the successful, what did we fail on? Is it the documentation piece was missing, or is it something else which they need to repair and amend? And from those failures as well, we will work together, maybe with them again, and module of constitutions. Here in the United Kingdom, the Charity Commission is very magnanimous. What they do is they have asked certain very highly successful, efficient organizations to publish their constitutions and memorandums, articles of associations online. And you can take those stock, they're called open source documents. And all you do is you put your own charity name, etc., and use those constitutions to adjust to yourself. So we can ask them to let us borrow their documents for those who are successful and work to that. So the second webinar is the more important one. This one is just to say that we need to, so that by October, those who have made a decision to go ahead and apply for this accreditation do so, knowing they've covered all bases, and then we can take it from there. Rachel?
Carl, just to mention that we do have a few more questions that have come in the chat.
Okay. Okay, this is a very good one. Beyond vitiligo, I'm so glad you guys are here. As you know, the Global Skin Alliance has been formed. I was there during its formation. In Geneva, we were instrumental in helping that Global Skin Alliance. We will try to put you into link with them. That's another good network you can join. Global Skin Alliance is going for a non-state actor in official relationship with WHO. So you may benefit from that, yeah? So Beyond Vitiligo could maybe ride on that success. Please do write to us. We will put you in touch with the Global Skin Alliance. And that's another route you can take besides our own route. We can work at that. That plus some of the funding arrangements that they've made with some like Leo Pharma and others, we can try to put you in touch with us. Yeah.
We have one more question from Dalia Dawood Kawaldeb.
Okay.
She's mentioning that it would be great if IAPO can also advocate for undergraduate and postgraduate healthcare medical education in Africa, to include some modules on patient and public involvement in research and patient-centric care.
Excellent. I think, well, thank you, Dalia. I think this is brilliant because one of or two of the bodies that I'm working with, trying to get them to become members of WHO Africa accredited, are the students federations, yeah. So the International Federation of Medical Students of Africa, and then the Pharmacy Students of Africa, and we're trying to make them become members. But then one of the issues that we have said is we can advocate for this undergraduate and postgraduate medical education in Africa. And this is where we come in. The reason why we want to be at that table in Africa with WHO is that we can advocate on this now, work on this platform. At the same time, work with the African Medicines Agency as well, and with the African Union. So if we can get, and CDC, obviously, yeah, African CDC, yes. So we would like to see the quadruple four parties and work with them, yeah. And you're right, the African Universities Network, Rachel, Professor Mani from Cairo, what's your network of? Rachel? I think she's muted up. Yes, so we can work on those.
Sorry, Kawaldeb. She's with the Association of African Universities.
Yeah, Association of African Universities and others. We're making sure that they take this challenge. Okay. Any more questions? No?
Yes, so we have Bismana, who's now ready to take the floor.
Okay, Bismana, come on. Bismana, you're muted.
Hello?
Hi, yeah, we can hear you. Yeah. Thank you.
Yeah, I'm going to visit Malaki to depot, but also I'm so happy about this international alliance patient organization. Uh,
We
I
have a
want to
problem.
say that the main problem because to get the payment is been get that this organization here can help them.
Sorry, Bismana, we're having a really
Yeah,
hard time
Africa.
hearing you.
Could you, Bismana,
Okay, madam.
type in the question in the chat? We could address that if that. Okay. Yes. So, Bismana, again, if you can type, I can then address that, and then we conclude this and set up the last.
Kaldip, just before we end, we have one last participant that would like to say something. We have a few minutes before the top of the hour, so I think we can go ahead and allow Liban to talk and say a few words.
Okay, do that, yeah. Do that. Thank you.
Hi, good afternoon.
Good
You hear me
afternoon.
well?
Yes,
Yes, we can.
I'm Liban Aden from within a relief organization and based in Somalia, and I'm very happy to be part of this and useful webinar. And it's really great for us to be a member of this advertiser call and WHO, and we are ready to be part of, and we are applying. And thanks for the invitation. And the other point is that first and partnering with the IOB, IBI International and Business Organization and WHO. Which one is faster for the for the local NGOs? Because I think you are the way through to the WHO.
Yeah, yes.
That's
So
as I understood.
yeah, you're right. With us, will be easier in that we are less demanding in that in how to incorporate you. Yeah, we are more tolerant, and we have got various. You can be an affiliate, or we can be a part of a member of our alliance to work with us. So in other words, you are given a slow pathway into that, and then final step is making you a member. By the time you have worked with us and you've built up your competencies and you've got that paperwork ready, you become part of us, and then you can then jump to WHO. So yeah, having you from Somalia would be great. As you know, we are based in London, and the building we are occupying, there are many Somali organizations as well. They're working both in London and in Somalia itself. So we do understand very often the way Somali organizations in Somalia are working is through extreme hardship and creativity. We need to help those on. So we do appreciate that. Yeah.
Thank you, Sammy. Thank you. Thank you. Well understood. Thank you.
Thank you. Okay. Rachel, is 1 o'clock. Is that when we end? Yeah.
Yes, that's correct.
Thank you. Thank you, everybody. Please do rejoin the WHO Africa's ongoing meeting. 72 Afro, look at the tweets that are going on and participate on that. We had some very good discussions on pandemic preparedness, on mental health this morning. We talked about overhauling mental health as an issue. And there are more things to come this afternoon about the current inflation and prices and access of medicines and innovation. Thank you very much, and do have a good morning, afternoon, and evening if you've joined the further part. Thank you very much. Thank you. Rachel, I'll join you in a few minutes. Yeah, I'll just could address this.
No worries.